Hello, everybody. I'm Sylvia Gonzalez, and I'm going to talk about a project to assess a serious game that is currently underway at the University of Applied Sciences and Arts of Western Switzerland. And I will mainly focus on the context of creation and on the presentation of this game, which aims to improve the skills of nursing students in palliative care. I will also talk briefly about the method used to evaluate the game at the end of the presentation. So, the creation context of the serious game End of Life can be summarized in a few points. And the first is demographic, with others like O'Brien, who report that 80-year-old people and over will reach 26% of the population in 2050 in Europe. Then this demographic change will inevitably lead to higher demand for palliative care. This means a need for trained caregivers and mainly nurses to accompany people to death. The second point comes from the observation that there is a significant heterogeneity in palliative care interventions, suggesting that few of them really benefit patients and their families. Another point comes from the fact that palliative care relies on an umbrella of treatments for physical, psychosocial, and spiritual symptoms that involves caregivers' high level of expertise in these different areas, and the acquisition of such skills build up as the nursing experience unfolds. Finally, another point reports that reports the difficulty of allowing the development of relational skills of nursing students in the traditional nursing education, which consists mainly of direct knowledge transfer or through scenario-based learning. In this context, the use of virtual reality can immerse students in a real care situation and help them to develop these skills. As most of the virtual solutions, like serious game, have mainly been developed in medicine, a serious game to accompany the end of life has been created by the University of Applied Science and Arts. Yes, the objective of the serious game End of Life is to recreate different situations of interaction between a nursing student who assumes the role of a nurse and a 90-year-old patient at the end of life through a scenario designed to reflect the patient's psychoaffective experience. So the story takes place in a residential home where a nurse, the student, has just arrived and will get to know a patient and follow her until the end of her life. The student will be able to establish a relationship with the patient and act with her through the different stages that mark the end of life. The goal of the game is to move successfully through the different stages or chapter of the end of life. And for this, the players or the student will need to demonstrate a certain amount of relational skills. So what we see on the slide is the interface and the instruction of the game. The scenario of the game consists of various chapters divided into scenes during which the student has to intervene with the patient. Each of these interventions with the patient takes place in a dialogue form in which the student is led to choose among different responses, as we can see on the slide. The responses can be more or less empathetic, compassionate, hopeful, and authentic. Based on their answers, the students accumulate points and obtains a score that allows him or her to move on the other chapters of the game or not. So very quickly, as a first user test has been conducted using a questionnaire assessing the game's ability to improve caregivers' relational skills, a project is currently being conducted to test through a behavioral experiment whether the game will have a positive impact on nursing student relational skills development. The experiment consists in proposing 10 minutes videotaped simulation with 1 month intervals. In this simulation, nursing students will endorse the role of a nurse who works with a patient at the end of his life. Between the two simulations, students will use either the serious game End of Life or a quiz for a month. After transcribing and annotating the verbal and non-verbal data from the simulations, we finally will compare the relational patterns produced by the students before and after the use of each of the two games using statistical analysis, and we expect that the serious game will lead to an improvement of the student relational skills. The experiment phase is currently underway, and if all works, we may be able to present the results of the experiment to the GSGS'21. For those interested, here are some references. And just a last word to thank the member of this project, Pierre-Alain Charmillot, Stéphane Gaubron, and Julien Sen. And thanks for your attention.